I hope everybody's been having a good day so far. We've had a couple of really good presentations, and not to be outdone, we've got Jim Hickey with us that's going to just dazzle us with one of our biggest concerns, and that's being paid. Before I start, I'd like to introduce myself. If you see the old guy with the red shirt, it's not your camera. I'm really that old. So I am retired Air Force. I retired back in 1992 after 20 years. During that time, I was a Air Force cop for 10 years, and then I was an Air Force recruiter for the next 10, which actually prepared me for my second career in medical practice management that started in 1992. So I've been doing this for quite a while. Um, I would like to just add, I'm the membership chair for Texas MGMA as well as the Secretary Treasurer. It's really important that we grow our organization from the bottom up. So please refer a colleague to join this great organization so that we can grow in numbers and continue to learn. Um, the other thing is every Wednesday at noon, we do have a lunch and learn, which is basically the results of the survey from the Friday Focus. We've had a couple of them so far, and they've been pretty well attended, and I think people have gotten a lot of good information out of them. But if you have questions, please put them in the chat box and address it to panelists and attendees so that everybody can see it. And while Jim's talking, if he doesn't see it, if it's at a point, then I'd like to go ahead and just interrupt and ask that question if that's okay with Jim. At this time, I'd like to introduce Jim. He is the current market president for South Texas and Louisiana's market leader at Cigna. Before that, he was with Aetna as a vice president and general manager for Medicare of Texas. He has a bachelor's of science degree at Providence College and an MBA from Central Michigan University in healthcare administration. So at this point, I'm going to go ahead and turn it over to Jim. If there's anything else you'd like to say about your background, Jim, about anything, go ahead and let them know. You've got a real good audience here.
Perfect. Thanks, Tom. And thanks everybody for having me here. I will try to adhere to something I learned in the Army when briefing. They always told me use the 3 B's: be brief, be bright, be gone. So I will try to get through this and see if hopefully it was helpful for you guys. Something we like to do at Cigna is kind of a collage of get to know people. So I have a lot of stuff here, just take 3 minutes to go through. Tom, like you, I'm retired military. My wife and I, who is in the center picture, both did 28 years in the Army in various roles. My wife and I, as you can see off to the side, like to do living history events. We haven't been able to do a lot of that. So at the bottom during COVID, I have gone back to some of the things I do love to do, which is woodworking and building some things, and then cooking. I am on the board of Theater Under the Stars, and we're very active in the theater and in the River School, which deals with special needs and uses musical theater to help special needs folks. And then my wife and I are very big on traveling, which we like to do, which of course we're not getting to do right now. Originally, I'm from Rhode Island, but settled here in Texas. And then little picture here I always like to share with people is the first job I ever had was I electroplated jewelry in a jewelry factory. And then worked my way here. So going to talk a little about, basics of health plan billing, getting your claims paid timely, quickly, and of course, correctly. I have some busy slides, but the good news is that there's some takeaways that we'll be sending out to everybody, which summarizes all of this into a desktop reference that you guys can have and print with this. So, the first step I always tell people is that whenever somebody comes into the office, it is always good to find out what their policy coverage is and what's available, what we can do and what the policies are. And I know that sounds very simple. I understand you guys are dealing with, 30, 40 different types of health plans and types of coverage and things like that. So again, I'm a big believer that, if you have desktop references or easy online references, it makes life a lot easier. We do have one. which is Cigna for healthcare providers. It is outside our firewall, so whether you are a Cigna provider or not a Cigna provider, it is available for you. And so you can get it either on the secure side or the unsecure side of our um, website. And it has pretty much our policies, procedures, and things necessary to get paid. I'm a big believer that, one of the things that's always kind of good to do is to get a copy of the individual's evidence of coverage, which you can get in the secure portion when you're looking someone up. And then you get a good idea if you put it in their chart, exactly what's covered and how it's covered for these. Just a little highlight on our outside the firewall website. As you can see, we have resources that cover just about everything we provide, from general how to read our ID cards, the different types of ID cards we have, to all our forms. Even our reference guides are out there. So we have the website up here for you, and again, we'll be sending out the reference guide later for you guys to look at. First step is always prior authorization. There are types of treatment and certain procedures that do have to be pre-authorized. We always say, when in doubt, call us, ask us, or check online. That is always the first step that allows us to be able to pay quickly, first pass, and without information. One of the other handouts that I've sent in that can be sent to all you is a detailed listing of all of those things that have to be pre-authorized or pre-certed. My recommendation is always check online, because policies are updated continually. And as we all know, with COVID, things are moving very quickly, and we are changing policies to try to adapt to the marketplace and the need of our providers and our members. But again, it is the first step that I always tell people: if in doubt that something is going to be automatically covered, just give us a quick call. And if something has to be done, we're going to accommodate you. Again, you can do that online, or you can just call us at the number that's at the bottom of the screen. So then the second thing, and this is probably, the most important, and I know you guys spend a lot of time on this and get a lot of training on this, but it always is good to go back to, claims when they're sent in have to be clean. We want to pay them quickly. It is a lot easier for us when we don't have interventions on claims. It's a lot easier for you. So knowing that all the data is there, it's all been submitted on a appropriate form, and that we have all of the data and the procedure codes, including the modifiers, makes it a lot easier when we're going through. Following the Clean Claims initiative put out by Medicare is usually the safest way to make sure you're going to get paid, and paid promptly. And we do have software in our system, so we do use Claims Extend, and we use McKesson, which allows us then to look at the claims, and if they can pass automatically or without intervention, they will pay automatically. 96% of our claims pay automatically. So again, this becomes kind of a stopping area where we're very big on our education and very big on trying to help our providers make sure that the claims come in can pass first time. Next big thing is always when to file. We get a lot of interesting claims that come in, and a lot of claims that come in, at different times and everything else. And so, as I keep saying, the prompter you send in a claim, the quicker, one, we can pay you, but two, the less flags it sets off in systems that will do reviews when we're getting claims that are very, very, very old. I think it's easier for you guys to keep things that happened and clear in both your records, and if for one reason there's questions on a claim, and it keeps us from asking any weird questions as to why a claim is so old. We don't auto deny claims for untimeliness. We do review them, and we have a myriad of exceptions to our policies, all based on if you're having to chase down, in other words, you're having to chase a bunch of other payers because you didn't get the right information, you didn't get their ID card, things like that. We're pretty flexible. And again, it's one of those pieces of advice that if you have a claim and for one reason or another it's old and ever gets denied for untimely filing, or if you're concerned on untimely filing, you can call us, and we certainly take into account all the extraordinary circumstances that go into getting your claims paid. Because we're a self-funded company, we are very attentive to filing timely claims, not just because we want to get you paid, we want to get things appropriately posted to people's accounts, but the payer also is trying to fund those claims and stay within their budgets. And so again, the more timely we have, the smoother it is, and the less questions get asked as we service your claims. Oops. If for any reason a claim doesn't get paid, not only are there appeal rights, but we really encourage you to go ahead and appeal. We do not want you guys having problems with claims, and we don't want you guys just sitting saying, well, we've got a large number of Cigna claims that for some reason or not are not paying. By all means, if you get a claim, the first thing we always say is call us at customer service, because we will try to resolve the issue right then and there. So if it's something that was missing from a claim, a piece of information, if it was an issue of not having the right information from the ID card or something like that, we want to try and get that up front and not get into a long protracted area. If it is a more complex area and we cannot get it in the first call, then we do ask that you initiate appeal through a written request. We have a pretty easy to use PDF form that is available back on Cigna for healthcareproviders.com, where you can get it and submit a formal claim and a formal appeal. Our appeals policies and all that are compliant with the Texas Department of Insurance and the federal government guidelines for ERISA plans. So we work them pretty diligently. And again, if we get into a position where your claim isn't getting paid for one reason or another, we highly encourage you guys to call us, ask, and see if we can't resolve it. Another big thing that we believe in is that we do a tremendous amount of value-based contracting. We do also what we call accountable care collaboratives with a large number of our provider groups. In this, we have several different programs that range from quality bonuses for making sure that annual physicals are done and certain measures are met, all the way up to full risk contracts where some groups can get paid, percent of premium and make additional money because they feel that they can manage the medical expense better than we can. So we are pretty flexible, and we work with over 22 groups here in Houston on our collaborative care program. We pay out and do a lot of promoting of these groups, not only internally and with the providers we deal with, but also our clients, and spend a lot of time going through with our clients the value that these collaborations bring and the savings, not just in a single claim or a single year environment, but especially over time. Cigna has been the top rated health plan by Leapfrog as being scored the highest on reducing unnecessary claims, improving the health of our members, and reducing long-term, or what I should say, medical trend in companies. And our goal is certainly to get medical trend down to CPI by next year. In Houston, our average trend runs about 2.5%. And that is in a environment where Milliman and McKesson are saying that trend will be anywhere between 6 and 10% in the next 18 months. So again, we don't do this alone. We do this through collaborating with our providers and making sure that we can provide the best value. And so if you're not in a group that has collaborative care arrangement, you may be interested in contacting us as to how you can join either one of the groups that do, and or get a independently established care collaboration program going. We've enhanced our systems, so we're now providing a tremendous amount more data to our groups on getting patient-centric alignment and continuous improvement on not just the whole book, but on individual members that we identify through our predictive modeling and through the information that the groups feed us, where we can literally head off some what we call the surprise events. And honestly, that's one of the big things that we spend a lot of time doing. Unlike other plans I've worked for, here at Cigna, I have a large group of individuals that are out at our clients. They're out in their offices, they're out in their work sites, and they are getting people engaged with their primary care physicians. We're getting a lot of people who have not seen their primary care physicians in probably 2-3 years because they don't really have anything going wrong, have gotten them to their primary care physicians, have gotten their annual physicals done, their health assessments done, and literally headed off some very serious medical conditions that were undiagnosed because the individual did not normally go to the office. And again, a lot of this is through the information that we're sharing back and forth, specifically with the group, sharing the goals and setting goals that are case mix adjusted to the challenges of the group. And then we're also leveraging a lot of our software and predictive modeling for the group so that they can also start to see where their highest risk patients are. So again, we spend a lot of time. We think this is a very good program, and I would highly encourage anyone interested to reach out to Cigna. Last thing I wanted to touch on, and it is a big thing, is we do have a robust fraud unit that goes out and looks at it and at claims and things that are submitted. You'd be shocked, honestly shocked at the number of fraudulent claims that are sent in a year. And some of them are, mistakes. Some of them are out and out, scams. And some of them are, being done. And when we investigate them, the provider who's actually supposedly getting paid has no idea what's going on. We have cases that we've been handling now on pass-through billing where our flags have flagged up where a provider is sending in claims. The claims have a different address and service address, different place where they want the check sent, and you deal with the provider's office and they have no idea these claims are coming in on their behalf. Same thing on pharmacy. We see a lot of pharmacy claims where doctors are supposedly providing prescriptions and the doctor has no idea who the pharmacy is and or where the prescriptions are coming from. So again, and on other examples we can show, we have a dialysis center here in Houston that sent $4.7 million of claims in the last 3 years on one patient, which is not practical nor possible. So again, there's a lot of different things that come in that we look at here, not only to protect our clients and protect the members, but also to protect you guys, to make sure that if we're seeing them, then most likely Medicare, Medicaid, and other government agencies are seeing them. And so again, we take a lot of time and effort and have a very robust program where we look at this. And then, again, I told you I'd be brief. All of this information that I'm covering and a lot more details are covered in our reference guide. There is a website here where you can get to that reference guide. It's also at the Cigna for Healthcare Professionals. I provided Betty with a copy that she can email out to all the attendees. This is a very detailed book. It is a quick reference guide, so it doesn't have every single thing in here, but it does tell you where to get the information online, how to stay up to date. I highly, highly recommend that if you're have a desktop reference when you're dealing with the plans, this is definitely a document that will be worth having on the desktop. So with that, I'll open it to questions. I'll kind of caution everybody up front that I am not the claims expert, but we can certainly get questions and then get back to folks if we don't have the information.
Right.
And Tom, I'll turn it back over to you.
Great, thank you. I do have a question for you. I realize that different health plans have different penetration rates across the state. And in the San Antonio area where I've worked the last 30 years, we have typically seen about 2 to 4% of a payer mix in most practices in the San Antonio area that are Cigna insureds. I remember when Cigna first came to the state, it's probably been 10, maybe 12 years ago. The plan was to actually start marketing more into San Antonio, but it seemed like it kind of dizzed out around the Austin area. Do you see any extra marketing going for there? Because Cigna actually pays pretty well for a small group compared to some other plans.
So the answer is yes. Actually, I've been with Cigna a little less than 2 years. I was brought in to see if we couldn't expand the footprint of the plan. We do have quite a bit of membership in South Texas, over 800,000 members, but you are correct. San Antonio and Austin, we have not, for some reason, pushed to really, I guess, entrench ourselves in those markets. I lived in San Antonio for 8 years. It's, near and dear to my heart. And yes, we are putting resources and a push forward, just to have more activity in San Antonio and the San Antonio-Austin corridor.
Okay. We have a question from Randy Becker, who's also from San Antonio. He's asking, what is the telehealth reimbursement policy for Cigna? If you're able to answer that question.
Yeah, so currently we are paying all telehealth the same way we're paying an office visit. We have a committee of physicians that are looking at the rules of how we're going to handle that, and I'll just say long-term, meaning forever. We know we're not going to go back to the old way where, it required special approvals and things like this. We are going to handle them as doctor's offices, but the rules get a little complex when you're dealing with, okay, you have a video conference with the patient and then a week later you have an actual office visit. How do we handle those types of events and how those get done? Do they pay individually? Do they get bundled? Do they, at all adhere differently? And so they're working on those rules now, and they will be published to make sure that we have a good policy going forward. Our company and our CEO David Cordani, we have been actually noodling on how to make video events more prevalent. And honestly, there was a lot of inertia from our actual members on using a lot of telemedicine products we put in front of them. COVID has kind of pushed the toothpaste out of the tube, and we're not looking to put it back in the tube. So we just need the right policies, procedures, and payment rules so that, again, we don't have issues on the back end when you're filing claims.
Okay, we have another question. This one is from Rebecca. She says, we've recently started getting claim denials citing payment policies. Codes are approved during the pre-auth, then denied when claims are submitted citing the payment policy. Why aren't these payment policies addressed during the pre-auth to avoid the denial?
And so, Rebecca, I don't know if I can specifically answer your questions because I don't have the claims in front of me. And I'm not the claims analyst. So I don't know specifically why they're being denied, but I would refer you back to either calling customer service if they can't resolve it, then download the form and fill that out and fax that into us and start a formal policy, a formal appeal, and they will be looked at. I don't know specifically what you build, how you build it, and if there was any type of limitation on the service. So I hate to armchair just say, because or something like that. So my advice here would be get the PDF form. It's pretty easy to fill out, attach the claim, fax it into us, and it will get processed through our appeals process and reviewed.
Jim, I'll say that you're a very brave man for wanting to present in front of a bunch of medical practice managers and executives, because the two biggest tasks we have are getting money into the practice and then HR. And you just happen to be on the hot seat about a topic very dear to all of us, and that's getting paid. That's how we stay in business, much like any insurance company does.
And we're trying to work with you guys. It's not our job to make it harder for you. We want to make it easier for you. It's our job to get rid of the waste, the fraud, duplicate services, and get people managing their health so that they're not having huge costly events when you guys could intervene very well up front. And so I appreciate you guys having me.
I have another question from Randy, and trust me, I didn't pay him at breakfast to ask all these questions, even though we did have breakfast together this morning for a board meeting. But is there a claims rep or a physician rep that the practice managers can contact with claims questions? Because also often you're not going to the right person. Many times you can make a phone call and talk to one person, and you can call the next day and get a different answer from somebody else.
So there is no one dedicated, claims rep. As you can imagine, we have hundreds of thousands of providers and get quite a few calls. So I wish there was a way to say, hey, you have one person that you could call and they'll solve all your claims problems. In South Texas alone, we have about 70,000 different unique providers that we deal with. So I unfortunately no, but I will say this, that our customer service number is available. We always have claims folks on it, and our customer service is open 24 hours a day, 7 days a week. So okay. 5 o'clock comes, we don't stop working. We don't start working claims. We don't stop answering questions.
Okay. Now your website, as you showed earlier, has a pretty good dashboard for it. On that dashboard, is there a section of that they can go to see what common claims are being rejected, much like what Medicare will send out to us on a monthly basis?
I'm going to write that down, and I don't know, but I will find out for you. Okay.
Because it's kind of like the definition of insanity. If we keep doing the same thing over and over,
yes,
expecting a different result, and sadly, sometimes claims are denied because perhaps the billing staff or company is not addressing trends with the practice management team and the physician as far as certain things like a modifier missing, or maybe they're not putting enough information to get a level 4 or whatever it might be.
And one of the common things, and I'm always a big believer in having run outpatient clinics in the Army and all this, is, when it's always good to talk to the patient and ask them what they've been doing, because there are a lot of folks out there and they have their list of 10 doctors. I got my foot doctor, I got my heart doctor, I have my primary doctor, and they're going out and telling them the same lists of complaints. And I know one thing that we have seen is, a lot of folks, they're not what I would consider to be shopping for services, but they're getting a tremendous amount of duplicate services because they go to one doctor and so they run a full blood, a Chem 17 or something like this, trying to resolve the problems they've talked to. Then they go to the next doctor with the exact same list and the exact same tests are coming up. And then sometimes, you do see claims where we're going to stop it and say, wait a minute, this is the 6th x-ray of the same area that's happened in a 3-month period. What's going on with this? Yeah. And stuff like that. So I think it's always good to talk to the patient, make sure we understand where they've been and who they've been talking to and what they've been asking for. And again, any time you're in doubt, you can call the customer service number. And I mean, they'll literally look up. So if someone's had 3 x-rays already, they'll help you guys get a handle of that film versus ordering another one.
Okay. We have a question from Stephen Johnston. He's a big shot with Texas MGMA. He was a president a couple of years ago. We always appreciate Stephen's input. What is Cigna's view on value-based payments and capitation? If you could answer that.
Sure. So we are for it. I am trying to expand that now, and we are working on new contracts. Cigna, we've had Kelsey Care, powered by Cigna, going on almost 15 years now with Kelsey-Seybold under a risk-based arrangement just like that. So, we're very interested in capitation. We're very interested in groups that, come up and say, hey, I want to take risk, either professional risk or global risk. We're working with them now to get them qualified and help them get all the tools in place as we, do the audits for the oversight that goes with that type of risk.
Okay.
The more risk you're willing to take, the more oversights and checks and balances we have to put in place.
Okay. And just so everybody knows, originally this presentation was supposed to have additional panelists besides Jim. Unfortunately, we had a Blue Cross rep that bailed out on Betty over the weekend. So that's why we've got a little bit more time than what I thought we had. If you have any questions, please ask them. Otherwise, Jim, if you have any closing comments, we can go ahead and wrap up and give people an early timeout so they can get back to things that they need to do in their practice.
Well, again, my biggest piece of advice is that when in doubt or if you have a problem, call us. I mean, we do resolve a lot of claims issues on the phone. And if you have a more systemic problem, get into our formal claims appeal process, because there's a lot of eyes on it. So we are constantly looking at appeals, especially appeals that we're overturning, and saying, all right, then do we have a bad policy in place? In other words, if we're rejecting a claim and 92% of them are being overturned, then the question is, does that policy work or not work?
Right.
So.
Okay. Well, great. Jim, thank you so much on behalf of Texas MGMA for presenting today. Betty, are you available to wrap things up, or do you want me to do my comedy routine for 15 minutes?
No, please don't, Tom. But
Thanks, guys.
I personally want to thank
Yeah.
Jim on a personal basis, because he was supposed to have a panelist and he totally flew solo and killed it. So anyway, thank you, Jim. I really appreciate it. You're a good sport.
And Betty, you should have an email with me with the
I do.
the quick guide and some other.
Yes,
information.
absolutely. Thank you for that. We'll get that distributed. And thank everybody for coming. We appreciate your patience with our technical hiccups, but we will see all of you tomorrow at 11 a.m. And thank you so much.